Welcome to the ATC-HSSC online training series, where you learn essential procedures that ensure safe and effective patient care. In this video, we'll demonstrate the correct technique for administering an intradermal injection. What is an intradermal injection? An intradermal injection involves administering a small amount of medication into the dermal layer, just beneath the skin's surface. It is typically used for sensitivity testing, tuberculin screening, and administering select vaccines or local anesthetics. Why is it performed? Intradermal injections are used for drug or allergen sensitivity testing to check for an immediate skin reaction. They are commonly used for the tuberculin skin test, also called the Manteau test, to screen for tuberculosis exposure. Some vaccines are given intradermally, where the medicine is placed just under the top layer of skin. Intradermal injection can also be used to give a small amount of local anesthetic before minor procedures. Injection sites. The recommended injection sites are the inner aspect of the forearm, the upper chest, or the upper back area. These areas are selected for their accessibility and visibility of skin reaction. Equipment preparation. Let's prepare the tray. You will need the patient's medication chart, prescribed sterile medication, a 1 milliliter tuberculin syringe, alcohol swabs, a pair of clean gloves, and a kidney tray or appropriate waste container. Step-by-step procedure. Confirm the patient's identity using approved identifiers and cross-check the medication order for the correct drug, dose, and route before starting. Perform thorough hand hygiene. Then, wear clean gloves to maintain infection prevention during the procedure. Withdraw the medication from the ampule or vial using aseptic technique, keeping the tip sterile, and do not inject air into the syringe. Position the patient comfortably with the selected area exposed and supported. Then choose a suitable intradermal injection site that is clean and easy to observe. Clean the skin using an alcohol swab in a circular motion from the center outward and allow the area to dry completely before injecting. Remove the needle cap carefully using the non-dominant hand and ensure the needle does not touch anything to maintain sterility. Stretch the skin taut with the non-dominant hand and hold the syringe so the needle stays almost parallel to the skin surface. Insert the needle bevel up very shallowly into the dermis, approximately 1/8 of an inch, so the tip remains within the skin layer. Inject the medication slowly and steadily, watching for a small raised wheal or bleb, which confirms correct intradermal placement. Withdraw the needle gently at the same angle used for insertion, taking care not to rub or press the site. Mark the injection site with a pen and document the date and time so the reaction can be checked accurately during follow-up. Post-procedure actions. Immediately discard the syringe and needle in a designated sharps container. Remove gloves and perform hand hygiene again. Document the procedure in the patient's chart, mentioning the drug, dose, route, site, date, and time. Common errors to avoid. Be mindful of these common mistakes. Inserting the needle at an incorrect angle. Rubbing the injection site after administration. Using a syringe of inappropriate size. Recapping the needle after use, which poses a serious safety risk. In real practice, intradermal injection is more than placing medication under the skin. It's about precision, safety, and observation. When performed with correct site selection, a shallow bevel-up angle, and gentle technique, it produces a proper wheal and supports reliable test or vaccine outcomes. For more practical clinical videos and learning content, visit www.healthcare-skilling.com. Thank you.